Dr. Michelle Savu. I'm Deputy Chair of Surgery here at BJU, and I'm so excited that we have Dr. Javid. He's coming to us all the way live from the UK. Thank you so much for coming today and joining us. We have lots of questions for you. Dr. Javid is a microbiologist and a professor at the Tsinghua University School of Medicine. He's and also physician scientist. Today, if we look at the worldometer, the coronavirus cases are about 730,000 worldwide. So these numbers are just staggering, and we've reached almost 35,000 deaths. We're certain. And interesting to me, China is no longer listed anywhere on the top three numbers. Now the US has overtaken China with 142,000 cases and about 2,500 deaths. And of course, we know that Italy has over 10,000 deaths and Spain a little bit behind with 7,000. The UK is only 1,200, but certainly you're earlier in the curve. So I think in different parts of the world, we have different concerns about this virus. Here in China now, we look like we're very much over the peak. And so our concerns in China are different than the concerns in the US and different than the concerns in the UK probably. But I guess we all have the overriding same kind of consideration. Here in China, we're most worried about backspread, about people importing the cases back in. How real is that kind of possibility, and what do you think the right measures are doing? You probably know in China they're quarantined very strictly, and they stopped all international non-citizens from coming in. Do you think that's the right approach? Is it a very big worry for this back spread? And the second question to that would be, what about when we introduce normal life back for school and other kind of people? Is this a problem for the spread of viruses?
Sure. First of all, thanks, Dr. Savu, for hosting this session. Just to clarify, I'm an infectious disease physician by training and a microbiologist by research. So, I'm an ID physician, although my research is in microbiology. I think this is the most important issue that you raise for China at the moment. And I think that the key consideration is that the epidemic has peaked in China for now. But in fact, even in Wuhan, more than 90% of people have not been infected. And certainly in the rest of China, 99.9% of the population have not been infected. And therefore, China probably now is the most vulnerable population on the planet for COVID-19. So, I'm not a politician. I'm not going to comment on, the political reasons for certain decisions. But unless China continues its strict quarantine and essentially closed border policy until it has a vaccine, which it has no way of ethically developing itself now, China is going to be stuck as a sort of isolated island, essentially for the next 18 months.
Wow.
Until there's a vaccine.
That is an amazing
So I think that China is currently, until it, 2 weeks ago, Beijing was seeing 20,000 inbound people, almost all Chinese expats, a day. That means 150,000 people a week, which is why China brought in the new regulations. Each airline could only have one flight per week per country to try to limit the number of people it needed to quarantine. But essentially it means that China has to continue closed door policy until and if there is a vaccine. And there is no, I'm reasonably confident there will be a vaccine, but it's going to take a while. And actually China can't now ethically test a vaccine because there aren't enough cases. So that's one thing. The issue about life going back to normal, I think there is a real possibility of getting cluster outbreaks after life goes back to relatively normal in China. But because China is very vigilant about outbreaks now, it's conceivable that those will be brought into control much more quickly, because, you know, the reality is nothing was done for 6 weeks in Wuhan after the initial outbreak, maybe 2 months, you know, so that's not going to happen again. Now, when you get an outbreak, you're going to, you know, step on it very quickly. So I think there is a risk of limited outbreaks after, you know, schools go back, after people start going back to work and so on. But it's, you know, I think China is in a very good position to control that. What China isn't in a position really is to open its borders for the next year, year and a half. So it's actually going to be the most isolated country in the world, possibly.
I think that's some sobering news for those of us here in China. So I guess my next question has already been answered. You don't feel there's been herd immunity here. You think that really there is not much immunity at all.
I think, you know, the reality is we don't know how much infection there is in China. And I think the reality is that China doesn't want to publish that data because it's probably done the studies by now. It's, you know, there's no emergency in China anymore, and there hasn't been for a month. So, you know, I think those data are probably available and not publicly, you know, available. But even in Wuhan, my own back of the envelope calculation suggests that possibly 1 million people were infected in Wuhan, but that's still only 10% of the population. It's nowhere near enough for herd immunity. And certainly outside Wuhan, we're looking at less than 1% and probably less than 0.1%.